I'm going to begin by asking a very simple question, just to put this into perspective for all the viewers watching this show, and that is, how infectious is the JN.1 variant and how much of India is affected already?
So right now I don't have any experience, but what we are reading, that this disease is quite infectious and even symptoms are a little different. And as far as virulence is concerned, we don't have exact data that whether it's very virulent or less virulent. But last time also things started somewhere from South Kerala and then later on spread to the whole country. And since it's a viral disease, probably it will not remain confined only to Kerala or southern India. Sooner or later it will come to northern part of India also, and once testing will be started. So I think we'll be knowing more about the disease from ICMR or from these authorities about its infectious portion and virulence portion.
All right, I just want to ask you quickly, has anybody come with that kind of symptoms that JN.1 variant has to the Gangaram hospital, for example?
No, we have not seen any patient in Gangaram so far.
Okay, so no patients in Delhi or specifically at the Gangaram hospital. But tell us, there are some who are already calling for mask protocols. Some schools in Karnataka have issued mask protocols. Is it time that people just start masking up, whether they are being told to or not?
I think let us wait for an advisory from the government, because they will be deciding about it. Once that is there, then we will follow that, Because ultimately, in any case, the prophylaxis parameter will remain same, maintain distance, wear mask, and wash your hands, etc. Those will still remain, but we have to wait for advisory from the government,
Okay, you're saying wait for the advisory.
Anyway, if you are wearing mask, otherwise it's quite okay. A lot of people I saw today wearing masks, that is fine.
Okay, but they say that these days most people are wearing masks because of the pollution and not necessarily COVID-19 variant. But the question I'm asking is that, last time around when COVID first came, we thought we were a little late to react to COVID, to clamp down, in terms of travel and other things. But the question here is, can we then this time around learn from those lessons and at least as citizens be more vigilant and start taking precautions before a final advisory comes from the government?
Yeah, I think people, after listening to news, already I have seen today, many people are wearing masks. They have, not because of pollution, but because of this fear of COVID. But in any case, people rise here only once things are there.
The question, the only thing is that this is considered a subvariant of Omicron variant, which is BA.2.86. This is considered a subvariant.
Yeah.
How different is it from Omicron? Is it very different from Omicron? Is it a new variant of its own with its own properties and a mind of its own?
So far we know that this is more infectious as compared to the Omicron, this variant. And as far as, respiratory symptoms like a cough or bad throat, they are less. And probably in many patients because of pneumonia also. But there are various reports as far as virulence is concerned. Some reports we are hearing that it's very virulent and very dangerous and causes death, but I don't know, we don't have data. This data had to come from authenticated source, not from something like newspaper or WhatsApp, Once the health department is going to bring some data, that will be authentic data.
Okay, the chief of the IMA COVID task force has said that 30% of patients with influenza-like illnesses and influenza-like symptoms were tested and they turned out to be COVID positive. So, this JN.1 variant, how similar is it to, what kind of similar symptoms it gives like influenza?
After all, this is a virus and it is influenza-like virus. So all these produce those symptoms, that is well known. They are going to produce influenza-like illness only. But the nature of illnesses are, later on, the effects are different,
Okay.
So I think you just wait for a day or two and probably a lot of things we will be learning about this disease.
News9 Plus. Download now.